Ontario will be giving a second dose of the AstraZeneca vaccine to anyone who received their first shot. The province had paused the use of this vaccine due to rare instances of blood clots. People who were among those first in line are being encouraged to make an appointment. That's because 55,000 of Ontario's AstraZeneca doses will expire in 10 days.
During the period of March 10th to 19th, 2021, may opt for an earlier dose interval of 10 weeks with informed consent. That means that you understand the data and information, you can talk to your provider, and they can answer your questions. Choosing to receive the second dose of AstraZeneca vaccine at the 10-week interval is safe and provides strong protection against the COVID-19 infection.
Dr. Dirk Huyer serves as Ontario's Outbreak Response Coordinator. He is in Toronto. Dr. Huyer, welcome to the show.
Thank you very much.
I want to start with AstraZeneca. I've got AstraZeneca injected into me a couple of weeks ago, so I have a keen interest in the future of this. And I want to start with the fact that you've unpaused the AstraZeneca program here in Ontario. But you're asking people to get their second shot before a current batch of doses expire at the end of the month, which would be about a 10-week interval when the science says 12 weeks is the best way to go. How do you explain this to people being put into that category?
Yeah, well, Health Canada has provided approval for 4 to 12 weeks for AstraZeneca, but the clinical trials have shown progressively increasing protection as you get more and more, as you get closer and closer to the 12-week interval. So 12-week is probably the optimal protection, but we certainly see significant protection in the period of time during the 9 to 12-week window as well. So what we're providing is the opportunity for people, if they wish, to proceed with receiving it at a 10 or 11-week interval, where we know there's still very significant protection from serious illness, hospitalization, and death, as well as from getting the illness.
Are you worried, though, that the real-world data that points to this 12-week mark as the maximum and most desirable time might limit some of the enthusiasm for people to go get the second shot if it's before 12 weeks?
Oh, for sure, but that's why we're giving people the choice. So what we're doing is reaching out to those who have had the vaccine during the period of March 10th to March 19th and provide them the information. They'll make their decision, and they'll recognize that they still get a notable improvement from their first dose to protect them from this illness and proceed forward in helping to get population coverage of second doses.
What's your sense now of just how confident people are in AstraZeneca at this point in time? Because it's been a real roller coaster for this vaccine in particular. And so now we have doses set to expire that you might have to take before the optimal time. There's talk of vaccine mixing. I mean, what do you say to people who are just confused or quite frankly reluctant because of all of this change in the science around it?
Oh, we certainly understand it, and I sympathize completely. So what we're trying to do in our robust safety surveillance is when we see something of concern, we want to bring that to the public's attention. We want to let people know. But at the same time, when you hear a concern, albeit very rare, it still undermines the confidence in a vaccine that frankly has done an amazing amount of success in the UK and other countries. So I recognize it, and what we try to do is provide as much information as possible for people to understand, to consider, and to make their choices. So I applaud those who got the AstraZeneca when it was available to them, because they were a significant contributor to population coverage to really help to decrease the burden of illness across Ontario.
Do you have any sense, though, if this has caused any hesitancy? Do you have any data? Has the government and health authorities gotten any feedback from people saying that they're out on AstraZeneca because of the concerns that have been raised over the last number of weeks and months?
We don't have any specific data, but we certainly have heard what you've talked about, and we consider all of those things in thinking through and making sure that we have the best understanding and provide the best available information to people to make their decisions.
Right, so there's about 2 million people in Canada who have had their first dose from AstraZeneca. I think the province expects to get about 254,000 AstraZeneca doses soon. So with what you already have in inventory, plus this 254,000, how many people can you quickly get the second shot to if they want it?
So we have about 55,000 right now that have the effective period still prior to May 31st. And we're offering that 55,000 to those about about 100,000, just under 100,000, who received their vaccines between March 10th and 19th. And that will be, many of them will be at 11 weeks when they would receive the vaccine. Obviously, the closer you go to the March 19th, the closer you go to 10 weeks. And then we move forward. Once we reach the 12-week interval, which would be in the first week of June, we will have the 254,500 to provide. And then we're hopeful and anticipating that we'll have more AstraZeneca to provide second doses in the period after that.
Okay, so with what you have now and with what's coming, that's enough for about 300,000 people to get their second dose. And going by memory, I think it's about 900,000 people have had at least one shot of AstraZeneca in the province. So the delta on that, the 600,000 that would be left over, will they be offered it at 12 weeks or could it be up to 16 weeks? Because NACI has said you can stretch it out as far as 4 months. Will you be looking to aggressively shorten that interval down to the optimal 12?
Yeah, as in everything else in the pandemic, we base our decisions on the data that's available and frankly, the supply that's available. We're optimistic that we will be able to provide all of the second doses, fully informing people as we get more information. But we're hoping and working towards getting them all provided the second dose at the 12-week interval.
And if someone doesn't want to take the second dose of AstraZeneca at the 12 weeks because of concern over VIT or the blood clot disorder or other scientific issues they may have with it, will they be able to get an mRNA vaccine at the 12-week mark, or would they have to wait for as long as, say, 16 weeks if they wanted to get their second dose of either Pfizer or Moderna instead of AstraZeneca?
Yeah, right now we're waiting for NACI recommendation around the mixing of doses, recognizing that the second dose risk based upon the UK data is at 1 in 600,000. So we are waiting for NACI. We should hear that information from the UK studies as well as a Spanish study, a little bit more detail in early June. And then that will allow us to provide further information about people who have options as far as second dose of AstraZeneca or an mRNA vaccine.
You know, Ontario also announced its plans for reopening today, with stage 1 can begin when 60% of adults are vaccinated with at least one dose. And the province is estimating that could be around June 14th. If you look at the big deliveries of this week of 4.5 million for the country and just where we are, it seems like we can get to 60% in Ontario before the 14th of June. I mean, do you have a sense of whether that timeline could be moved up if the vaccination rates are higher?
Oh, absolutely. We're tracking for 65% above age 18 by the end of May, if not a bit earlier. But that we will. I feel very confident that we will be at the 60% of first doses. I have no hesitation in saying yes to that.
And how concerned are you? You're not concerned about that, but how concerned are you about this long weekend? I mean, every time we have a holiday in this country, the cases seem to spike shortly afterwards. How worried are you about the May 2-4 weekend?
Well, again, I hope that everybody will be thoughtful in everything that they do, recognizing the potential for transmission even when you don't have symptoms, following the public health measures, and really taking all of those steps to reduce any potential transmission. We know that outdoor activities are much safer than indoor activities. The weather will be better, hopefully, and that will allow more people to be outside as opposed to inside, and then taking the appropriate precautions outside should hopefully reduce any transmission that may occur over this long weekend. And as we continue to have greater vaccination, protection from illness, both getting the illness, but also transmission and any serious illness and hospitalization.
Okay, Dr. Huyer, thank you so much for your time.
Thank you very much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.